one of the biggest heartwarming moments is meeting a beneficiary from Malawi and who said, my eyes were so opened to how the world works. And this was one of the most useful projects I've ever been engaged in. And I learned a lot, and I'm still using that, even after IMCHA has closed shop and moved on. And that's what we aspire to, that we don't just run a project, that we build processes and systems that endure and survive and are sustainable beyond, a single project.
So the APHRC in full is the Health Policy Research Organization. And it's a mechanism, I would say, or a model, which has been developed by funding agencies in the Canadian government. It's a model that APHRC tested in a previous initiative, which was looking at the health of women and children. So what a health policy research organization does, it is to facilitate the transfer of skills and knowledge to research teams that could be spread across the world around what we call evidence-informed decision-making frameworks. So our role as an APHRC is to facilitate the transfer of skills and capacity, in some instances for research itself. So we may end up doing training in different research skills, but then importantly, it is to facilitate how researchers are able to connect with decision makers in the transfer of evidence and knowledge for decision making. So it's a very broad range of skills transfer that could include how to do a policy brief. It could include how to make a PowerPoint presentation. It could include how to prepare for a meeting with the minister. Our previous experience, that's what we ended up doing. It was to facilitate how research teams can understand how policymakers work, how they function, and then how they can engage in a way that is productive.
The second thing, of course, is that the High Commission has mentioned the COVID-19 pandemic is the context in which this initiative is situated. And we know that there's been a reverse of the little gains that had been made in terms of gender equity worldwide. But also, I think it showed us that we are connected as humanity and that there must be systems and processes that produce solutions for all humanity.
So the Women Rise Project, the background to it is the fact that the COVID-19 pandemic affected women in ways that are different from how it affected men. It affected women in terms of how it changed their care patterns. They were forced to take on much more care responsibilities than previously. It affected women and men perhaps the same way in terms of job losses and all the other psychological and health impacts. But then when it came to the expectation for care, much of that expectation fell on women. When schools were closed, they're the ones who looked after the children, make sure they did homework and all that. When people fell sick, most of the care responsibilities fell on women. So as a result, collectively from the world, it is now understood that the gains which had been made in the area of gender equity, we moved a few steps back as a result of the pandemic. So the Women Rise project, actually, there are 23 research teams. And these 23 research teams are spread across 4 continents. So Africa has the biggest research teams, but then there are teams from Latin America, teams from Asia, and one team from the Middle East. And so they're trying to find evidence, do research that shows how can we reverse the steps we made backwards as a result of the pandemic, so that we can do better policies, do better programs, so that women, the losses we made in terms of gender equity, we can at least make them up with an evidence-driven approach in the different countries. Unpaid care work is a big driver of paid work. So unpaid work is a big driver of paid work. You're able to work because you can pay somebody to take care of your baby. And so if we look at unpaid care as a big part of the broader economy and try to put mechanisms that make it better, that make it in terms of quality, but also in terms of access, then in the end, you're actually pushing the paid care forward. If more women are able to work because they have good care of their children, if more women are able to enter the economy because their grandparents and their sick relatives are being taken care of in a way that is of good quality and acceptable, then in the end, there are other economic returns, ultimately. There are ways in which, for instance, women can work comfortably after having families. Things like workplace support. for breastfeeding, things like creches. That's one side of things. But then there are other things of how to improve now the quality of the care that women are able to leave their children with. So there are many dimensions on how this can be done. But what we expect to see is that there are 23 research teams from different continents, and collectively we are going to learn and see what works in one context, maybe what works in one country, and then in the end support governments to make evidence-informed policies.
And that we must shift the balance of power in who produces solutions for the world. And therefore, how solutions are produced, how they are communicated, how they are shared, how they are used must be a joint effort. And that we must reach a point where every part of the world can produce solutions for every other part of the world, and not sort of the unidirectional mindset or what pertained in terms of the inequities in power.
The typical is north-south, Canada to the rest of the world. But now we're saying we want Latin America with Africa, Asia with Africa, Asia with Middle East. So south to south collaboration. And we want to see south to north. It shouldn't be that it's Canada to the world. We want to see Malawi to Canada, Malawi to Brazil. So we are looking at south to south, north to south to north partnerships that facilitate learning, but at the end of the day that are respectful of everyone's contribution to not just the evidence, but also the policy change that we hope to see.